This class we're going to discuss about the female reproductive cycle. The female reproductive cycle, otherwise known as ovarian cycle or uterine cycle or menstrual cycle. This cycle approximately in the female reproductive life occurs 28 to 29 days. It starts from menarche, that is the puberty, to menopause, except during the pregnancy. The cycle of events start from one menstrual period till the next one is called menstrual cycle. During this cycle, endometrium undergoes many changes every month. The cycle menstruation is the indicator for the normal female reproductive phase. Then, female reproductive cycle controlled by monthly hormone cycle from the hypothalamus, anterior pituitary, and ovary. Menstrual cycle comprises four phases. First one, menstrual phase. Second one, follicular or proliferative phase. Third one, ovulatory phase. Fourth one, luteal or secretory phase. Menstrual cycle first phase, menstrual phase. Okay, it takes 3 to 5 days. The cycle it will start from the menstrual phase only. When the menstrual flow is due to the breakdown of endometrial lining in the uterus and its blood vessels due to the decline in the level of progesterone and estrogen hormones. Menstruation, it does not occur. Okay, so when it does not occur, ovum is not fertilized. That means absence of menstruation may be indicate the pregnancy. However, it could also be due to the stress, hormonal disorder, and anemia. Second phase of menstrual cycle, follicular or proliferative phase. It starts from the fifth day to until the time of ovulation. During this phase, primary follicles in the ovary grows to become a full mature Graafian follicle, and simultaneously endometrium regenerates through the proliferation. These changes in the ovary and uterus are induced by the secretion of gonadotrophins like follicle stimulating hormone, luteinizing hormone. Gradually it will be increased. It stimulates follicle development and secretion of the estrogen by the follicle. The given picture clearly explains female reproductive cycle. What are the changes in female body? The first one, ovarian cycle, body temperature, anterior pituitary hormones level, ovarian hormone level, then uterine cycle, endometrium condition. Ovulatory phase, about the 14th day. During this time, both the hormones, that is the luteinizing hormone, follicle stimulating hormone, attending the peak level in the middle of the cycle. So here the maximum secretion is luteinizing hormone. So it is called as luteinizing surge. So it is induced the rupturing of the Graafian follicle and release the ovum. That ovum, it is a secondary oocyte. So where it will be released? Ovary wall into peritoneal cavity. So that process only known as ovulation. Luteal or secretory phase. Okay, it will be start from 15th day to 28th day. Okay, this phase remain part of the Graafian follicles, or Graafian follicles is transformed into the transitory endocrine gland. That gland is known as corpus luteum. This corpus luteum secretes a large amount of progesterone hormone. Okay, it is very useful for the maintenance of endometrium. So, if the fertilization takes place, it is helpful for the implantation of fertilized ovum. The uterine wall, they secrete the nutrient fluids, not too much for, it is useful for the fetus. So, that's why it is called as the secretory phase. During pregnancy, all the events of menstrual cycle stop and there is no menstruation. Suppose absence of the fertilization, the corpus luteum degenerate completely and leaves a scale-like tissue. The tissue is known as corpus albicans. Okay, this corpus albicans initiate the disintegration of the endometrium, leading to menstruation and ready to making the next cycle. Menopause. Menopause is the phase in the women's life when the ovulation and menstruation completely stop. The average age of the menopause is 45 to 50 years. It indicates the permanent cessation of primary functions of ovary. Polycystic ovary syndrome, PCOS. Okay, it is the complex endocrine system disorder. Poly means many, many cyst. Okay, many partially formed follicles but do not grow to the maturity are produced eggs. Okay, that eggs it will be called as the, it will be surrounded by the one um, watery fluid. So that is called the polycystic ovary. So the given picture here, right, left side they given the polycystic ovary and right side they given the healthy ovary. Symptoms for polycystic ovary syndrome: irregular menstrual cycle, increased androgen hormone level, and excessive face growth, facial hair and body hair growth, acne, obesity, reduce the fertility rate, and increase the risk of diabetes. Okay, these are the symptoms for polycystic ovary. And what is the treatment? Okay, there is no medicine for this, only healthy lifestyle, then weight loss and targeted hormone therapy it will be given for the polycystic ovary. Menstrual hygiene. Menstrual hygiene is vital for the good health, well-being, dignity, empowerment and the productivity of women. The impact of the poor menstrual hygiene on the girl is increase the stress level, fear and embarrassment during the menstruation. This can keep the girl inactive during the such period, leading to absenteeism. Clean and safe absorb cloth material, sanitary napkins, pads, tampons, and menstrual cups has been identified as the materials used for manage the menstruation. Changing sanitary material 4 to 5 hours as per the requirement provides comfort, cleanliness, and protection from the infection. It also helps in enhancing the quality of the life women during the period. Disposal of napkins. Use sanitary napkins should be wrapped in the paper and disposed. It should not be thrown in the open areas or drained pipe or toilet. Flushing of sanitary napkins in the drain pipe causing choking of the drainage line leading to water pollution. The eco-friendly way to dispose menstrual waste scientifically and hygienically is to be destroy the sanitary napkin using incinerators. Measures are be taken to the install in incinerator and napkin winding machines in washrooms of schools, college and public facilities.